How do antiemetic medications manage post-op nausea after surgery? Imagine feeling sick after surgery and wondering how to get relief quickly. That's where antiemetic medications come into play, helping you feel better faster. When you have surgery, your body can react with nausea or even vomiting. This happens because signals from your brain and stomach tell your body to feel sick. Antiemetics work by blocking these signals. They target specific receptors in your brain and gut that send nausea messages. These include serotonin receptors, dopamine receptors, and corticosteroid receptors. By blocking these, the drugs stop the feeling of nausea and the reflex to vomit. Many patients experience post-operative nausea and vomiting, which is called post-operative nausea and vomiting. It can happen to up to 80% of people after surgery, depending on the type of anesthesia and individual risk factors. To prevent or control this, doctors often give antiemetics before surgery or as soon as nausea starts. This helps patients recover comfortably and reduces delays in healing. There are different types of antiemetic drugs used. One common class is serotonin receptor antagonists, like ondansetron. These drugs block serotonin receptors in the brain and gut that send nausea signals. Ondansetron is usually given through an intravenous line or taken as a pill. Another class is dopamine antagonists, such as droperidol and prochlorperazine. These block dopamine receptors involved in nausea pathways. Sometimes, doctors combine these drugs for better results. Corticosteroids like dexamethasone are also used. They reduce inflammation and have anti-nausea effects, especially when combined with other medications. Other options include antihistamines and neurokinin 1 receptor antagonists, which are used based on the patient's needs. Using a mix of these medications from different classes often works best because it blocks multiple pathways that cause nausea. For example, combining ondansetron with dexamethasone can be more effective than using one alone. Treatment usually begins early, as soon as nausea symptoms appear, rather than waiting for vomiting. Medical teams monitor patients closely after surgery to see if nausea persists. If needed, antiemetics are given on the hospital ward to keep discomfort at bay. Managing nausea this way helps patients recover more smoothly, allowing them to eat and drink sooner. This supports physical healing and proper nutrition, which are key for a good recovery. It also helps prevent dehydration and wound issues caused by vomiting. Patients who feel less sick tend to be happier with their recovery experience. If you have a history of nausea with anesthesia or medications, tell your healthcare team. This information helps them choose the right antiemetics for you. Side effects are usually mild but can include headaches, dizziness, or feeling sleepy. In short, antiemetic medications manage post-op nausea by blocking the chemical signals that cause the feeling of sickness and the urge to vomit. They are often used in combination to target different pathways, making recovery more comfortable. This approach helps you heal faster, eat better, and feel more at ease during your recovery process after surgery.